Hi everyone. So this is the fourth video in context to the orthopedic images. There are many images in the orthopedics which are asked in the exams. So in the first image we can see it is Adams forward bend test, and Adams forward bend test is used for scoliosis. Basically, if the person will be bending forward, the spine will look symmetrical, and if it is asymmetrical or rib hump is seen, then it is known as scoliosis. Then the next image we see, it is showing the congenital scoliosis. The child is presenting with the scoliosis. In the X-ray appearances we will be discussing. Now again, the signs of adults and idiopathic scoliosis in a girl. Okay, head will not be centered over the body. One shoulder will be higher, one shoulder blade higher and possibly more prominent. Unusual gap between the arms and trunk. Unusual gap will be there between the arm and trunk. Spine will be obviously curved and one hip will be more prominent. So, one hip more prominent, one scapula more prominent, spine will be curved, unusual gap, head not centered. These are all the signs of idiopathic scoliosis in an adolescent girl child. Then again, we have a test, Plum's line. On the posterior aspect, a line is drawn from occiput and it should normally align with the gluteal cleft. And if it is not centrally lining, then it is scoliosis. Then this is X-ray showing congenital scoliosis. Let's discuss what are the findings. So what findings we will found in X-ray? The partial unilateral failure of formation. Okay, partial unilateral failure of formation. This is known as wedge vertebra. Then complete unilateral failure. Complete unilateral failure is known as, see, this side is not completely formed. This is known as hemivertebra. Means only half vertebra has been formed. Then is unilateral failure of segmentation. Vertebrae are formed, but they are not segmented. Then this is known as congenital bar. And if the bilateral failure occurs, then it is block vertebra. Okay, block vertebra, congenital bar, hemivertebra, and wedge vertebra. These are the findings we will be seeing in the X-ray. Okay, here also we can see this side is fused, and in the previous X-rays also the hemivertebra are present, hemivertebras. So these four findings can be found in the X-ray of the child or adolescent with the scoliosis. Then next we have the Barlow's test and Otolani's test. Barlow's test and Otolani's test, these are the two tests that is for the developmental dysplasia of the hip. In the Barlow's test, Barlow's means flex and adduct the thighs. Okay, flex and adduct the hips towards the midline. In the Barlow's, basically we are femoral head dislocates posteriorly. If we adduct the hips, okay, then the femoral head will be dislocated. And Otolani's test is abduction. Otolani's is related to abduction, and femoral head reduces into the acetabulum. Basically, Barlow's is for the dislocatable hip, while the Otolani's is for the correction of the dislocatable hip. How will you remember? In Barlow's, LO is coming, and dislocatable also LO will be coming. While in Otolani's, OR. OR means correction. So correction will be there in the Otolani's. Correction of the displaced segment. Barlow's means add and adduction, and Otolani's is abduction. This is another test known as Glazes or Ellis test for DDH. In this, basically, we will flex the legs of the baby, and here we can find that there is a difference in the height of the two patella. That is, two knees are not parallel to each other. One knee is lying higher and one is lower. This is due to developmental dysplasia of the hip. Then this is McMurray's test. McMurray's test is for the medial meniscus. Examiner applies one hand at the knee and other hand holds the foot and the ankle, and extremely rotate the foot and apply valgus stress. Okay, the person will be rotating, the examiner will be rotating the foot and valgus stress, that is from the outward to inward stress will be applied, and this will be for the medial meniscus, McMurray's test. Then next we have the Dial's test. Dial's test is basically for the PLC injury, posterolateral corner injury. If negative at 30 degree means no posterolateral corner injury. If positive at 30 degree and negative at 90 means posterolateral corner injury. In relation to the knee joint, basically we are talking. And if both 30 and 90 positive, then is combined posterolateral corner and posterior cruciate ligament injury. Okay. All negative means no injury. 30-degree posterolateral corner, 30 and 90 both PLC and PCL. Dial test. Negative means it will be coming towards this side. Positive means it is everting. Then next is Patrick test. Patrick test is basically flexion, abduction and external rotation. As the position was there in the anterior hip dislocation, the similar position is made and it is known as Patrick's test. Then this is the test for the ligaments. Okay, for the anterior cruciate ligament, the examiner will be drawing the leg towards himself as seen in this image. While for the anterior cruciate ligament, another test is their Lachman's test. Lachman's test as shown in this image. And if the examiner is applying the force towards the patient, then it is posterior cruciate ligament test, and this is for medial collateral. In the medial collateral, examiner will be holding the leg towards himself, and in the lateral means if the examiner is taking the legs towards himself, then it is taking the leg laterally, means that he is testing medial collateral ligament, while if he is bringing the leg medially, means he is testing lateral collateral. So in relation to the ligament testing, we need to remember that the leg is held in opposite direction to test the ligament. Anterior cruciate drawer test, Lachman's test, then posterior cruciate ligament test, and then the medial collateral and the lateral collateral ligament. This is Hoover's test. Hoover's test is for neuromuscular weakness. Person is in supine position and the examiner places his hand beneath the heels and asks the person to apply the pressure on the heels. If he is not able to apply pressure, the contralateral hip rises. Then it indicates that neuromuscular weakness is there. Hoover's test. Then this is showing the testing of the hip movements. Here the leg is being took laterally. It is testing internal rotation, and here it is testing external rotation of the hip. And this is Ober's test. Ober's test is for the fascia lata or iliotibial tract. The hair basically knee is flexed to 90 degree and leg is abducted. It is for fascia lata, Ober's test. Then hip adduction and abduction are tested like this. Then is Ganselen's test for the sacroiliac joint. Here basically sacroiliac joint, pubic symphysis and hip joint pathology or L4 nerve root lesion. These things are tested. One leg is put into flexed position, another is extended and put downwards on the floor. While one leg is going towards one thigh is going towards the abdomen and the other thigh is going towards the floor. It is Ganselen's test. For the sacroiliac joint, pubic symphysis region, in this region any pathology is there, it is used to test that. Then we have sectoral sign. Sectoral sign is basically, it is for avascular necrosis or osteonecrosis. If the hip is extended, internal rotation will occur. But if hip is flexed, internal rotation is grossly restricted. In avian, basically abduction and internal rotation, ABIR. This is restricted. So if the hip is flexed, then the internal rotation will not occur. Okay, and passive flexion of hip external rotation will occur. That is called Catterall's sign. Internal rotation is not occurring, means sectoral sign. External rotation is occurring, that is Catterall's sign. Then this is Thomas test. Thomas test is used for fixed flexion deformity. Here the flexion deformity will be there in the hip region, and this is due to psoas muscle. The classical example of this is TB hip. Thomas test is used for testing that. And we need to remember the steps of the Thomas test. In this, person is made to lie supine, then the lumbar lordosis is calculated, and then the person is asked to bend his leg and take the thigh towards his abdomen, and if flexion deformity occurs, that is calculated. So that were the important images of the orthopedics. Let's quickly revise the test so that it is easy to revise them at the end. This is Thomas test for the fixed flexion deformity, sectoral sign and Catterall sign for the avascular necrosis. Ganselan's test for sacroiliac pubic symphysis, hip joint pathologies, hip adduction abduction, Ober's for the iliotibial tract. Then internal rotation, external rotation, Hoover's for the neuromuscular weakness, draw test, Lachman test, posterior and medial collateral ligament, Patrick test, Dial test, McMurray's test, Galeazzi's, Barlow's, and Ottolani's test. So that were all the important tests. I hope you will find it helpful. Thank you.